Start now. Okay. So good morning. My name is Dr. Erewole Ojo. My time starts counting from now. So I have a case report of gender dysphoria in a child with DSD. Next. Okay, these are the authors. And we all work at Massey Street Children's Hospital. Oh, I'm sorry. So the first two work at Massey Street Children's Hospital, and Professor Duwole and Dr. Yunisi, they work at Luth. Dr. Onile was a ex-house officer of House of Massey. So I would like to start by giving some background definitions. Gender assigned is the sex, male or female, assigned to a child at birth, most often based on the child's external anatomy. Gender identity is the personal sense of one's gender. Now, gender expression is how a person presents gender outwardly through behavior, clothing, voice, or other perceived characteristics. Usually, these three are in harmony in most individuals. Now, gender dysphoria, GD in short, is defined by the Diagnostic Statistical Manual for Mental Retardation as a marked incongruence between one's experienced gender, expressed gender, and the gender assigned. And this will last for at least 6 months before we can say the person has gender dysphoria. These individuals usually express or affirm themselves according to the gender at which they identify with. Now, it presents a 5-year-old child who resists being dressed like a girl and affirms as being a boy and not a girl. She presented 5 years ago in our facility at the age of 22 years with clitoral hypertrophy. So they were not able to determine whether she was a boy or the child was a boy or a girl. She also had, the child had labial fusion and was dark. There was no vomiting, no significant weight loss, no seizures, no loss of consciousness. So, a presumptive diagnosis of DSD, secondary to simple virilizing congenital adrenal hyperplasia in a female infant, was made. Based on these results, there was low 8 AM cortisol levels, low sodium, elevated potassium, elevated testosterone, an ultrasound scan that revealed internal female genitalia, and a karyotype that was done later on that revealed 46XX. The child was commenced on hydrocortisone tablets at 10 milligram per meter squared with good compliance until age 2 years, and on account of financial constraints, the child defaulted, the mother stopped buying the drugs, and then the child later on presented with worsening, evidence of worsening virilization. Now, this is a flow chart of the results over the first 2 years. And here you can see the potassium levels was initially elevated until about that, the last one was normal. Sodium was low, chloride was low. 8 AM cortisol levels was low. Testosterone was markedly elevated. We could not do the 17-hydroxyprogesterone on account of financial constraints. It would have been elevated based on all the other results too. The ultrasound scan revealed an internal genitalia of uterus. Normal adrenals were also visualized. Her bone age at a certain time when we did it, was advanced. Her blood pressure was normalized, and that's why we said it was a simple virilizing CAH. That's her cytogenic report that revealed the karyotyping, that revealed that she's a 46XX. You can see that the Y band is totally absent. So that's a picture of her external genitalia. You can see that even though she was 5 years old, she was virilized with puberty. She had a premature puberty, and you could see the clitoromegaly. Again, the clitoromegaly. Then you could see that there was fusion of the labia, and the only opening that you can see there is the urethral opening. So this is just the adrenal steroidogenesis pathway that explains why she had elevated testosterone levels. She probably had a blockage around the 21-hydroxylase, that's the commonest. Yes. So in conclusion, gender dysphoria can occur in female patients with CAH. It may result from inadequate treatment and subsequent elevation of androgens. A multidisciplinary approach is required for optimal management of gender dysphoria. You need a psychiatrist, a psychologist, in this environment, a religious leader, family members, extended family members, the surgeon, and